welcome to the Advanced Cranial Nerve Examination. So, it's very rare that our brains are processing only one type of sensory input at a time. Our nervous system needs to be able to handle multiple types of stimuli at once. We just want to make sure that your cranial nerves aren't just working individually, but that they continue to work in concert with each other when more than one is being stimulated at a time. We perform a traditional cranial nerve exam accompanied by some mild distraction in the form of mild, sort of quiet, soft noises happening close to your head. This exam is for people who've been through cranial nerve exams in the past, but who'd like to be tested on a new level. Does that sound like you? Great. Okay. Well, let's go ahead and get started. Melanie, you can come in now. So, basically I'm going to be running through the cranial nerve exam that I believe you've been through before. But what's going to be happening is my assistant over here, Melanie, is going to be creating some assorted soft noises happening around your head. I won't be warning you about the noises ahead of time. I won't be telling you about them. They serve as a more effective distraction from the primary stimuli of the cranial nerve exam if you don't know what's going to be happening. None of them will be startling. None of them should be loud or frightening. It's just going to be some gentle background noise, okay? First I'm going to start off by attaching some electrodes to a few different points on your face. And that's just going to help us monitor exactly how this sensory input is being processed in your brain. Okay? So, let's start off. Stick this one right here. Great. Now, and this one's going to go right here. Perfect. Other side. And then one more. Okay. I'm just going to make sure that all of those are secure. Perfect. Alright. Now if you'll just give me a moment, I'm going to go ahead and put on these examination gloves. There we go. And we'll be starting by testing the accessory nerve today. So, what I would like for you to do first is I would like you to shrug your shoulders, okay? Up. Good. And let them fall. Shrug them up. Let them fall. Up. And hold them. Let them fall. Great. Turn your head to the side and to the other side. Once again to this side, as far as you can comfortably turn it. You should feel a little stretch, but it shouldn't hurt. Okay, and to the other side as far as you can comfortably turn. Perfect. Alright, I'm going to do the shoulders one more time. I'm going to be putting my hands on your shoulders. I'm just going to be giving you a little bit of resistance as you shrug them. So lift your shoulders up and drop them. Lift them up and let them fall. Perfect. This time I'm going to be putting my hands on your face. And I'm just going to be giving some gentle, very gentle resistance against your face as you turn it from side to side, okay? Go ahead and turn your head either way. Perfect. And turn it the other way. Great. Okay. I'm going to move on to the hypoglossal. Alright. I'd like you to please stick out your tongue for me, just as far as it'll stretch. Okay. I'm going to be looking very closely. Alright, looks great. Now, you can take your tongue back into your mouth for a moment. What I'm going to be asking you to do next, I'm going to ask you to stick your tongue out and move it from side to side. Okay? So once again, stick your tongue out. Great. And move it to the side. Other side. Other side. And back to the other side. Fantastic. Alright, next we'll be testing the glossopharyngeal and vagus nerves. I'm just going to be doing a quick articulation test. I'm going to be repeating a couple of different specific syllables in each ear. And what I'd like you to do is I'd like you to repeat those sounds after me. Okay? Ready? Okay. I'd like you to say ka. Again, ka. One more time. Ka. Great. Now, repeat after me. Ga. Again. Ga. One more time. Ga. Excellent. Now we'll be going through a few different tests to evaluate your facial nerve. Okay. So I'd like you to start by raising both eyebrows. Raise them up and relax them. Raise them up and relax. One more time, raise them up and relax. Now can you frown for me? Just make a big dramatic frown. And relax your mouth. Frown again. And relax. One more time. Perfect. Okay. I'd like you to go ahead and show me your upper and lower teeth, just kind of like baring your teeth at me. Great. Let your mouth relax. Show me your teeth again. And relax your mouth. One more time. And relax. Perfect. Now give me a big smile. Big toothy smile. And let your face relax. Big smile. And let your face relax. One more time, big smile, big, 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 and relax. Okay. Puff out your cheeks for me. And let your face relax. Puff them out. And relax. One more time, puff them out. And relax. Great. Okay. One more test for the facial nerve. I'm going to have you close your eyes really tightly, and then I'm going to put my fingers on your lower and upper lids, and what I'm going to do is I'm going to try and open your eyes with my fingers, and I'd like you to resist. So while I'm trying to open them, keep trying to squeeze them nice and shut, okay? So go ahead and close your eyes. Okay. Just gently placing my fingertips on your eyelids. Okay. And squeeze your eyes shut while I try and open them with some gentle pressure. Keep squeezing them shut. Okay. Awesome. You're doing a great job. Alright. I'm really impressed with how well you're doing. Do you take a lot of cranial nerve exams? Now we are going to go ahead and test the optic nerve. So what I'm going to be doing first is I'm going to have you cover each eye one at a time, and I'll be wiggling my finger in the periphery of your vision. I just need you to let me know when you see my finger wiggling, okay? So you can go ahead and cover this eye first. Yep, cover it up. Perfect. Okay. Now just let me know when you see my finger. Okay. Great. Perfect. Alright, go ahead and cover up the other eye. Alright, once again, just let me know when you see my wiggling finger. Perfect. Now, continuing to test your optic nerve, I'd like you to pick a point on the wall behind me and just stare straight at it. I'm going to take this pen light, I'm going to be shining it into each of your eyes directly, and I'm just going to be checking your pupillary response. So just pick a point. The light might be a little bright, but it shouldn't be too harsh. So if you can just pick the point and stare straight ahead. Okay, I'm going to start with this eye. Ready? And try not to blink, but you can go ahead and do so if you absolutely have to. Good. Keep staring. Excellent. I'm going to be looking the other eye now. And keep your eyes fixed on that point. Back to the other eye. Other side. Excellent. All right. This next test is pretty simple, and it simultaneously tests your oculomotor, trochlear, and abducens nerves. What I'm going to be doing is I'm going to be taking my finger and moving it around in a pattern. What I want you to do is just go ahead and fix your eyes right onto my finger and follow it as it moves, okay? Excellent. Next we'll be testing the trigeminal nerve. I'm going to be touching your face with a few different objects. I'm going to start with a cotton swab. I'll be touching a few different points on your face very gently. I'll be letting you know. I'm going to have you close your eyes during this, but I will be letting you know when it's touching you. We're not trying to trick you with this test. We trust you to tell the truth about what you're feeling. So as I touch these different points, I just need you to confirm that you can feel it. So I'll say touch when I'm touching you. And if you can feel it, just say yes. If you can't feel it, say no. We'll do the cotton swab first. Then we have a sharp object. It's not sharp enough to hurt, just enough to register with the nerves in your face that register sharp objects. And next we have a blunt and chilled object, and I'll be touching your face with that, and that'll feel a little cold on your face. Once again, it shouldn't feel uncomfortable. We're just testing different types of nerve receptors in your face. So, I'm going to go ahead and start with this cotton swab. If you could go ahead and close your eyes for me. Okay. Once again, as I tell you that I'm touching you, say yes if you feel it, no if you don't. Okay. So, touch. 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 Okay, go ahead and open your eyes. So I'll be taking this right here. As you can see, it has a little point to it. It's not sharp enough to hurt. Feel a little poke on your face. But it won't hurt. It won't break the skin. Okay. So, once again, if you could close your eyes, I'm just going to be touching you with it very gently, and I'll let you know when. Okay. Touch. Can you feel that? Go ahead and open those eyes again. And the final part of the trigeminal nerve test, we have this blunt metal rod right here that's been chilled. It's very cold. So once again, close your eyes and just confirm for me if you can feel this. Touch. 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 Alright. You may open your eyes. Passed with flying colors. And finally, we're going to be testing your vestibulocochlear nerve. For this test, what I'm going to be having you do, it's a two-parter. First, I'm going to have you close your eyes, and I'm going to lean into your ears, first on this side, then on this side. I'll be saying a series of different numbers very quietly, and what I'd like you to do is just repeat the numbers as you hear them. Go ahead and close your eyes. Thank you. Alright, and as I say these numbers, once again, just repeat them exactly as you hear them. 1, 13, 6, 37, 300, 14. Perfect. Let's try on the other side. 5, 12, 87, 700, 14. Great. Let's try it one more time on each side. A little quieter this time. 14, 17, 91, 6, 231, 4, 1, 200. Okay, other side. 9, 800, 542, 12, 37. Great. Alright, so what's going to be happening next is I'm going to take my hands and I'll ask you to close your eyes again. What I'm going to do is I'm going to alternate back and forth, sort of rustling, making a little rustling noise with my fingers in your ears. And as I do it in each ear, I just want you to indicate which ear you hear it in. So if you hear it in this ear, you can either say, so if it's in your left ear, and you hear it in your left ear, you can either say left, or you can just raise your hand on that side, whatever's more comfortable with you. Okay? Just go ahead and close your eyes. Perfect. I'll be moving back and forth. Just let me know which side you hear it on. and open your eyes again. Alright. Well, that's the end of the test. I'm just going to go ahead and take a moment to remove the electrodes from your face. One moment. Start over on this side. Removing the first one. And removing the second one. Perfect. Other side. Removing the first one. And the second one. Excellent. So, the good news is you passed your advanced cranial nerve exam with flying colors. I'll be looking at the readouts from the electrodes to confirm and make sure that I didn't miss anything, but it looks like you were right on the mark with all of these. Once again, though, I know that the health of your cranial nerves is very important to you, so feel free to come back as often as you'd like for either a traditional cranial nerve exam or the advanced one. And thank you so much for being such a wonderful patient today. Take care.